to be carcinogenic, but nowadays is proved and carcinogenic to humans class 1 by the European Commission. So every employer has the duty to minimize the exposure to this dangerous and carcinogenic solution.
I want to split my talk in two topics. First, as Gianluca described just before, the important point of the employee safety in the operating theater, operating room. And second, the pathology for the diagnostics, very important, a few words about the fixation samples of specimen. As you all know, is a standard for fixation very important for an optimal diagnostic. And if the exposure with formalin is too high, you have to do a lot of things. You have to mark danger areas. You have to implement access restriction. You can take or have to take technical protective measures. I want to show you the influence on the fixation, on the morphology in the next two slides. You see a lymph node, you see a germinal center, and the staining is H&E. What do you think about this section? Do you think that's a good morphology? Do you think that's a good and optimal staining? I don't think so. The H&E staining has no contrast. If you look at the cells have shrunk. We have a lot of artifacts, and the section is too thick. And as you know, if you want to validate, for example, a biomarker, you have to check the quality of your fixation, because that's very important. You have to check it by 20 positive cases and 20 negative cases. And if you think about HER2, for example, breast cancer, and the discussion about HER2 low, the fixation is very, very important in the future for that question.